let's just go right into it with Dr. Felix Cabrera, the Chief Medical Officer for the Department of Public Health and Social Services. Doc, good morning.
Good morning. How you doing?
Doing pretty good. We're having fun.
Yeah, you guys on a roll here.
How about you? How are you doing?
I know.
How you doing? I guess we could just start, Doc, if you wanted to respond or anything to any of the vaccine questions or points that were brought up.
Well, there's sorry, I've been listening in and out as a trying to multitask here, unfortunately. But I think the overarching message that I think we need to get across is that, let's start with the vaccines, is that let's remember that this is logistically it's the most complicated logistics effort that we've ever seen since World War II. And we're dealing with uncharted territory. We're trying to use existing knowledge, and knowledge is coming in, daily. So because of that, there needs to be a level of tolerance that our community, we hope to ask for, in that when we set goals, when we set targets, they change. And it's going to be difficult to stay completely up to date, and which year 1 week may start expanding or changing, in the following week. And we'll try our very best to keep the message consistent, and we owe that to the community, and we will work very hard with that. But we hope that the community can work with us as well, and just before being necessarily upset or mad about understanding one thing, just try and look up and see if there's more recent changes, and that's the best that we can ask of them, and we hope that that comes true. So that's really the main part here. And so because there's I listened to a bit of with Senator Blas and Senator Adam, and they made very good points and some very good recommendations. But it is true that there are numbers that don't seem like, if you didn't get the full sentence and you just heard the one number, you may not get it. So, like for example, the 42 days. And so what the CDC is saying is that they're comfortable basically with you getting your second dose up to 42 days after your first dose. So if it's Pfizer, between 21 and 42, if it's Moderna, between 28 and 42. Not that that you should get it at 42 or any, there's no hard number. It's just that there's a window there, right, where everyone should feel comfortable if you fall into that.
I mean, Doc, we only question that because when we did the rollout of the vaccine, you guys were very, very firm on the 21 days, and then a month later, it's kind of like you said, the CDC recommends up to 42 days. But how much of this is trying to manage our inventory and maybe stretch this window so that we can be sure that everyone's going to get the second shot?
Yeah, so it's definitely a balancing act that we have here, and we didn't have that necessarily that window that we were given this information when until a little bit later. So, and also that what was an unknown during the early parts of our vaccination effort was what was going to be the compliance for those coming in for their second shot. We didn't really know if people are just going to be happy with getting their first and then not really be interested in the second. But what we learned is that, wow, they are very compliant, and I'm very proud of Guam because we're looking at about at times 93% compliance rate with those coming in within a plus or minus 4-day window of that 21 or 28 day marks. So because of that, we are very happy with that. First of all, I want to be very clear, we're very happy with that. But as we try and see where our inventory is, and again, there is a race to vaccinate and to get as many people into the vaccination as we can, especially if one of these variants are introduced in Guam, which could be devastating. You think August, September, October, November was bad? Try doubling it. Try doubling as bad as that was easily. That's what's happening in the United Kingdom, and that's with their lockdown. By the way, they were in lockdown when this variant strain started to spread and became the predominant strain in the United Kingdom. and yet they doubled their hospitalization rates than they've ever seen throughout the pandemic. So that's what we're really afraid of, and that's what we're really focusing on again, right? So it's because of that we were trying to find this balance, and so we're not necessarily moving the goalposts here. We're just trying to see, which side of the field do we really need to be playing on, and as we go forward. So that's really where we're at. I know that's a lot of general statements, and it's not really that informative, but I'm hoping to just understand that this is complex, and we're all learning on a daily basis here, and we hope to give you the best the best results ultimately. And we're one of the top in the nation in terms of our shots in arms per capita, and then the rate that we're giving it shots in arm per capita. And so we need to we should be very proud of that, and that's the big picture part here. So yes, there are going to be some nuances and complaints that come through it, but then big picture is we're winning here, and we need to continue the momentum.
But Doc, you said yourself in the hearing last night that we're in this race to vaccinate, and we ran so fast in this race that we nearly finished our whole supply of the vaccines. And now we're in this situation where we're having this conversation about, are we going to have second doses? And then, there's something else that you touched on about making the ask for help. When you mentioned the variant and saying that it could be twice as bad as it was during the height of the second surge if this variant gets out in the community. I heard you say something that we can't ask for travel nurses, or we can't ask for doctors to come back to Guam because they're busy fighting COVID everywhere else where it's raging.
Yeah, it was going to be much more difficult to do it in that sense, because, and that's even FEMA has, they've made that plea with us multiple times to please, you guys are doing great. Please keep doing great, because they won't have they can't just deploy medical personnel assets, like they did back in August and September, so that they are not going to be available because they're all deployed and being consumed in the fight right now, stateside. The rates are down overall, but not the deaths. The deaths are still pretty flat, and hospitalization rates are also down, which is good, but it's still at an extremely high point compared to any other time in the pandemic. So because of that, it's not going to be as easy to get help here, if it came to that point.
So is that, I guess, the ask for doubling our shipments of the vaccine? Is that part of the argument in terms of like us being vigilant against this variant?
Absolutely, and let's also remember that the importance for Guam and the Mariana Islands to be vaccinated very quickly is not just because of our limited access to resources, but because of our strategic military point in the region, right? And so if the community is compromised, the military could be compromised, and DOD. So we right now, or any vaccination that the DOD does, for us that's kind of extra credit when we're thinking about our herd immunity. But we're still looking at it as a whole. Even though the JIC numbers are not reporting necessarily DOD numbers, it's just civilian-based vaccinations. But for all these different reasons why we're trying to make the argument, and the governor is reaching out again to General Perna, as she had mentioned to us yesterday, that she'll be doing, and so we're also trying other avenues, talking to our Region 9 acting director as well. Dr. San Augustine reached out to her and made a plea as well. And then we've looked at other back channels as well. And so just so it's clear, they have been increasing our allocation on a monthly basis. Okay, it's been going up incrementally, and they're promising more throughout, and we have every reason to believe that it will be more. Will it be as much as we want? It's probably not. Will it be adequate? Right now, I'm redoing some numbers and projections for that. If they keep going at the same allocation increase as they're giving us right now, we might actually have over 200,000 shots by July 21st. So there's a chance for that, but the feds have to do their part to do that. And this is not even factoring in Johnson & Johnson if it gets its emergency use authorization, and that's one shot. So then all of a sudden, this, getting to herd immunity is going to be much easier for those who choose. Now, the option of getting, Pfizer versus Moderna, that's not as your first dose. That's that option is extremely limited, not non-existent, but extremely limited right now. But once the Johnson and Johnson comes online, and we get an allocation of it, which will maybe be in the next probably in the next 1 to 2 months. In the FDA committee doesn't meet again until later on this week, even though Johnson and Johnson has already submitted their or submitting their applications. Sorry, later on this month, I should say. Sorry, February. So it's probably in March or so when we could potentially be seeing those vaccines. So at that point, we do have to give the community a choice, and that because it's two very different vaccines and with different efficacy rates. And just to go, I know Dr. Hua deferred to me about the efficacy of the Johnson and Johnson. Mm-hmm. So first dose, there's 72% efficacy in the United States. In Latin America, it was 66%, and in South Africa, it was 57%. So it doesn't directly address the United Kingdom strain, but it shows how much decreased efficacy it has in the South African strain, for example. Wow. But the good news is that that's all above 50%, and which is what we really need it to be.
Not 95% though.
Not 95. You're absolutely right.
Doc, there was a line of questioning about the critical service workers, and it kind of seemed to me, based on their description of what is a critical service worker, that there are a whole lot of critical service workers out there who are getting exemptions to quarantine. When we hear how worried you are about the variant, do we need to examine this criteria for critical service worker and maybe narrow it a little bit more to kind of cover any gaps that we have with the variant spreading? Because we've seen that when you come to Guam with your negative test, like in the instance of the 2 Guard members, they came to Guam, but then they ended up pretty much catching COVID on the flight, right? So are we looking at critical service worker definition and exemptions, and are we going to be tightening those?
Yeah, I think that we have no choice but to relook at that and retighten it, and then and what's already happening is doing more surveillance, right, and enforcement. And so remember that these critical service workers all have employees, basically. I mean, employers, and the request and responsibility comes from the employer, and so, or as the one that's supposed to ensure that they're following the protocols as well. So it's a shared responsibility in this, but ultimately it falls on, of course, public health to ensure that that compliance. But also, this we're looking at other strategies in terms of testing. Re-looking at our testing requirements for them prior to arrival. Right now it's 5 days, probably should be 72 hours. And then especially because it is easier to get a test now, stateside, for example. And then also testing upon arrival here, whether that's immediate or within 5 days, something along those lines. And so, they're critical and essential for a reason, and we can't necessarily change a lot of them. In a lot of cases, these are healthcare workers. But the way that we ensure that they are mitigated to the best that we can, and yet they can still perform their duties is something that we are continuing and actually really focusing on right now.
I had just a couple of things that I wanted to follow up on, but first I wanted to ask if you had any other information, because it was kind of shocking to hear about this 18-year-old that had passed away from COVID. It's so young. Do you have any other information as to what exactly happened?
No, I don't. That unfortunate young lady, she was taking care of GMH, and I don't have any information about her case and the events that led up to it. I've heard some anecdotal statements, but nothing that I would make any statement or opinion on, except for just saying that every death is tragic, and what makes it more tragic is when it doesn't make sense to a lot of people, especially their loved ones, and when there's conflicting information that may occur either by accident or just by just misinformation, completely. Because of that, it's understandable to be angry. I want to acknowledge that they have every right to be angry if they are. But time will be will hopefully provide more information and hopefully provide more closure. And our prayers are to them, and God, I just can't imagine what they're feeling right now.
Do we know if she was part of many of those high risk areas or anything like that?
Yeah, I don't have any of that information.
Okay.
Sorry.
Okay. There was something that I think it was Annette who, going back to the oversight hearing, there's something that Annette had mentioned, and I think it was community vaccination clinics that could be starting this week in Agate, and I think Mila.
Yeah. So just to be very clear, these are for the homebound patients, and so they're specifically for the homebound patients the list has already been made and provided by the mayor's office. So this is not just a walk-in for anybody. Okay, I just want to be very clear. And that's so when they go out to the homebound, especially those that are bedbound, they're going to be going specifically to their homes. But in partnership with the mayors, they may set up the main hub or pod at the senior center and then transport them to that, which is going to be a much shorter drive and obviously a much smaller crowd and much easier to do. And these are primarily for a lot of these are second dosers that are needing their second dose, and they are clearly delaying their second dose just because they for a lot of reasons they were able to do that first shot, but just absolutely can't do it again. And so this is to help accommodate them. But again, some of them are getting delayed doses, and that's okay, and they'll be protected.
The isolation facility. So what's the plan for that? It's going to be moving out of Bayview.
Yeah, that's what I heard. And this is something that the office of the governor is working on, and because they are primarily lead in procuring these different sites. But obviously, we want to ensure that everyone has, especially during a tough time, especially in isolation, that means you are COVID positive, that you're in a more comfortable setting, and I think that's important for healing as well.
So, do you know where?
No, I don't.
No,
I don't.
How soon?
No, sorry.
Okay.
We didn't. These were early discussions yesterday during the governor's brief, but I haven't had any updates since.
So someplace more comfortable. That's all we know.
Yes, absolutely. That I can assure you.
Bree?
No, I
just want to go back. Sorry, to the 18-year-old tragic story. But Doc, I got a 17-year-old son. I mean, there's a lot of people out there who have, young adults, children in the family. I understand you can't say much because of the HIPAA. But what would you say to those people out there who look at this and, I mean, they're just anxiety, worry, stress, because it kind of seems like we're posturing towards normalcy with the vaccinations. But this, for me, was a real wake-up call, right? When you have someone so young.
And especially when from my understanding, at least, is that there was no existing comorbidities, with this particular young lady. But all I can say is that, to ease everyone's anxieties, is that be vigilant about seeking care. Be vigilant about not delaying care. And so if you're sick, if you've been sick for a while, don't just write it out, and especially if there's even a question of COVID. COVID, can it's an upper respiratory viral infection, but what usually leads to people getting much sicker is a pneumonia that develops on top of it. And so when it comes to pneumonia, you're dealing with bacteria now. So they take advantage of that, your weak state, and that's what the pneumonia can develop. And sometimes that pneumonia can be delayed. And so because of that, we really want to ensure that people are vigilant, that even if you think you got over COVID, but if you're starting to feel sick again, that you don't ignore that, that you go back and and get checked at either at your your doctor's clinic or at the emergency room.
Right. So, Doc, I mean, you stand by that. I mean, I know you weren't the one who tested or anything, but just from a public health standpoint, you guys stand by that determination that there was a COVID-related fatality?
Based on our definition, yes.
I wanted to bring up something that it was actually Dr. Hoa who mentioned it last week regarding pre-arrival testing requirements and the possibility that maybe we should look into because of what's happening with the variant. And I think it was somebody during the hearing last night mentioning how the variant was in Hawaii, and the PAG was looking into the possibility of just making it mandatory for pre-arrival negative PCR testing no matter where you come from, as opposed to the current CDC guideline if you're coming from an international destination that you have to have that pre-arrival test. Is that something you guys are possibly looking into implement?
I think that's something that we have to look at. In fact, the CDC is already considering that for all domestic travel, and so there's heavy discussions about that. So they may make that determination for us, to increase that floor, so to speak, right? And then we would, naturally rise with that. We're waiting for word to see if they're going to do that. But again, it's something that we have to seriously consider. We are hoping for results of our screening for the different strains to come back in the next week or so. They asked us to give them about 2 to 3 week turnaround time, and so maybe next week we might have some information, and then we'll go from there. Again, I want to, if we find out that the strain was caught, it was here on Guam, but it was in the quarantine facility, then yes, that's going to be cause for concern, but it's only going to prove how much more important the quarantine facilities actually serve.
Well, I thought what was also interesting during the oversight hearing, as we talk about being vigilant against the variant, was there was something that you mentioned that, okay, so we sent the 20 samples last week, but it's something that you guys are going to be doing routinely now for this genomic sequencing. Yes.
And so, we're going to be doing that basically about every 2 weeks. We're going to be sending samples to the CDC. And I believe they're not going to restrict us to 20 samples this time. We may be able to send more. And again, we'll send an equal share from the quarantine facility and from the community. And so they'll be fairly randomized so that they're a good representation, and so that we can have a better chance. I wish we could send them all, but that's not the case.
So, Doc, if we do get these things back and it says yes, it's the variant, is there going to be any rapid retooling of any of our mitigation or protocol efforts to kind of deal with that?
I will say that it will definitely things will definitely change, especially if it was a community case that showed that was one of the strains. As for the quarantine right now, as we're, what we're doing, is already, pouring that up, and the mitigation efforts, it's accounting for that. But human nature is that we're going to want to do even more if we have that new information.
So yes.
Yeah.
Gotcha.
Well, we're going to have to, right?
Yeah.
Yeah.
All right, Doc, anything else before we let you go?
Well, the last thing I just want to say is that, as we make these efforts and we try and improve on our process, one of the best things that we have on our side as we move forward and looking at, several months to get, these vaccinations is the main thing here is tincture of time. With tincture of time, things will get better. And we'll do better with our vaccinations, for example, and then we'll get closer to herd immunity. And so it will take some time. So it's like a lot of hurry up and slow down, hurry up and slow down. But the big picture is that, we will get there. Okay?
Right. But in order to get there to herd immunity by July, we really need to get those doses, our allocation, up to 40,000? Is that what was mentioned? Mm-hmm. And if not, then we're looking at herd immunity by the end of the year, based on the rate of allocation we're receiving now.
Yeah, if there is no change, if there is no change in the rate, then you're looking at toward the end of the year. And President Biden has already said that it's unlikely to reach that the United States as a whole will reach herd immunity before the end of the summer. And so he's already made that statement, which I think is accurate. But that doesn't have to be our story. We can have a much, much better story.
Well, I'm all for happy endings, Doc.
Yep, we will. This will all be a happy ending.
All right.
Thank you for your time.
Thanks, Doc.
There you go. He's the Chief Medical Officer of the ESTA.
Right, stay for everyone.
Okay. The Department of Public Health and Social Services, Dr. Felix Cabrera.